Hey future doctors, welcome back to our channel Dedicates You. In posting you may notice newborn with the red swollen eye. It could be ophthalmia neonatum, which is also called as neonatal conjunctivitis, a serious eye infection that needs urgent care. In this video we will cover causes, symptoms and treatment and prevention to protect newborn vision. Stay tuned to learn why early detection is crucial. So what is the definition here? Ophthalmia neonatum is a bilateral conjunctival inflammation in newborns who are less than 30 days. Okay, it is preventable condition caused by infections acquired before, during and after birth. As simple as that. Okay, it is a inflammation which affects both the eye of newborns who are less than 30 days old. Okay, the infection can be acquired before birth, during birth or after birth. What is the etiology here? Mode of infection. Okay, before birth, which is very rare but caused due to infected amniotic fluid in prolonged membrane rupture. Second one is during birth, which is most common route in vaginal delivery from an infected birth canal. Third one is after birth, which is due to contaminated hands, cloths or bath water. So these are the mode of infection. Depending on the mode of infection, that treatment is also different for children. So what are the causative agents here? The chemical conjunctivitis is caused by silver nitrate or antibiotic prophylaxis. Gonococcal infection, which is very dangerous and may also leads to childhood blindness, and other bacteria like Staph aureus, Haemophilus, strep species are also causes here, and chlamydia trachomatis, which is the most common cause in developed countries, and herpes simplex virus, which is very rare but caused due to infected birth canal. Okay, so as the causative agents are different, the incubation periods are also different here. Like chemicals are 6 hours, gonococcal are 2 to 5 days, other bacteria are 5 to 8 days, chlamydia are 5 to 14 days, and herpes simplex are 6 to 15 days. Okay, now the important task is clinical features. In eye diseases, all the clinical features will be same, like red eye, itching eye, pus eye, etc. It is very easy to write in the examination, but it is very tough to differentiate the situation in clinical posting. Okay, so the symptoms and signs are eye pain or tenderness, purulent discharge if it is gonococcal, and swollen eyelids, red chemotic conjunctiva, corneal ulcer, which is rare but dangerous in gonococcal or HIV cases. So these are all the hallmark. If you don't remember the signs, you can write the cordial features of inflammation, because it is inflammation of the eye in neonatal. So what are the complications here? They are corneal ulcer, which leads to perforation and which leads to blindness in neonatum in case of gonococcal cases. Staphyloma, which is bulging of weak or thin layers of eye. It can be ciliary, anterior or posterior. Okay, and septicemia if infection spreads. So how do you gonna prevent this? Prevention depends on the mode of infection, whereas treatment depends on the causative agent here. Here prevention is antenatal, like before birth. It is screening or treating maternal STDs like chlamydia, gonococcal or herpes. And during birth, you can ensure hygienic delivery and clean baby's closed lids properly. And in postnatal, you will give povidone iodine 2.5% eye drops to prevent infection, or tetracyclines or azithromycin ointment for bacterial prophylaxis. And lastly, ceftriaxone 15 mg by kg IM can be given in case of high risk gonococcal exposure. And the treatment is also very easy, which is general rule, like collect the conjunctival swab, before giving antibiotics. Means you should not give broad spectrum antibiotics here. Like chemical conjunctivitis, you need no treatment because it is self-limiting. But in case of gonococcal, you must follow the procedures like saline lavage hourly until discharge clearly, and bacitracin ointment 4 times a day, and systemic ceftriaxone 75 to 100 mg per kg by day. IV or IM should be given for 7 days. And in case of bacterial, you must give broad spectrum antibiotic eye drops, or in case of chlamydial infection you can give topical tetracyclines azithromycin for 3 weeks. And you may also give systemic azithromycin 50 mg per kg per day by 2 to 3 weeks. And in case of herpes simplex conjunctivitis, you must give topical antiviral because herpes simplex is an virus. Antiviral drugs plus IV acyclovir, which is an antiviral drugs. Okay, so to make it easy, for chemical, no treatment. For gonococcal, first clean the eye, next give bacitracin and systemic ceftriaxone. For bacterial, give broad spectrum antibiotics. For chlamydial infections, give topical tetracycline or azithromycin, and systemic erythromycin should be given. And in case of virus like herpes simplex virus, give topical antiviral drugs plus IV acyclovir. Okay, so these are the important features you must know because it is most common in children. Okay, if you find this video helpful, consider subscribing to the channel. Teddy Gets You for more interesting videos regarding MBBS lectures. This is Harshita signing off. Thank you so much.